Hi, my name is Claudine Lewis. I'm a Southeast Community College respiratory therapy student. I'm here to go over some oxygen delivery devices with tanks and flow meters. So first off, I'm going to start with the oxygen tank. Oxygen is always green in the United States. This is a small cylinder. It is labeled E. There's a little dot right there. And there's also some DOT markings and stuff up here. It's got the serial number and the date of last inspection. And there's no asterisk to indicate that it can go more than 10 years without an inspection. And there's no plus sign to say it can be filled 10% above the 220 maximum PSI. So with an oxygen cylinder, it should always be kept upright. It should never be allowed to tip over, knock over, so this is pretty sturdy. You don't want to grab it by the neck, which is right here. The risk of shearing it off is pretty high. You could have kind of a missile on your hands because it is a gas under pressure. So it's got a built-in pressure relief valve in case it does get involved in, like, it gets overheated or something like that, and it's able to expel the gas without becoming a missile or exploding because it is under pressure. So we're going to start off by, and this is going to be a little bit noisy, cracking the cylinders is what this is called, and it just kind of clears it of debris. Always want to have that away from your face. So there's no debris that's going to get into the patient's airway. So here's a regulator, and inside the regulator is a little rubber and metal O-ring. I don't know if you can see that very well. That kind of helps create a seal, and you'll know if that's missing or is falling off pretty quickly because you'll hear an air leak. Let me see if I can get this on here a little bit loose to kind of demonstrate that. And this has got a pin system on it, so it can't be mixed up with a larger cylinder. Let's see how to make that leak. Yeah, I can feel the air coming at me, so it's not on quite tight enough. So tighten that up really good. No leaks, I don't hear anything. So excellent. I've lost my train of thought, I'm not gonna lie. So this is showing about 400 PSI. It's just a hair below the 1500. It's kind of between the 2000 and 1000. So, and here's the dial to control the meter flow, and then here's where you would attach your oxygen delivery device. So this one goes up to 8 liters, so this is low flow. So if I had this on 4 liters a minute, this would, at 400 PSI, the cylinder factor for the E-cylinder is 0.28, so 1400 times 0.28 is 392. Divided by 4 liters per minute, which will give you about 98 minutes or 1.6 hours. Most of the factory recommendations are to change out a cylinder between 300 and 500 PSI, just so you don't have any residual dirt or debris in the bottom of the tank. Okay, so now that I'm done with this, let's say I'm getting ready to change it out to a new cylinder. I'm going to turn my tank off, which is always to the left. And I'm going to bleed out any excess pressure before I take that regulator off. So the dial goes back to the red, which is 0. One other consideration with oxygen is you never want to have it around petroleum products. Some patients have been known to put Vaseline in their nose because it does dry out their nose when they're on a cannula, and that can spontaneously combust, which is a really bad idea. So here we have a flow meter. This has got the quick connect method, so you just kind of turn that so that it'll fit into the wall. And there's the dial, and then here's another dial, and this is, if I can push this in, I can change these to come out of different devices. Like this one is for a ventilator, so, and see how it's threaded, and then the ones for the small delivery devices is just kind of, I would call it a nipple. So there's the green on, so that would be a place where you could have some problems, where you might not get flow out of the correct one, and then you just kind of need to turn that, make sure you're in the right place. So I've got it on the one for a cannula. Turn my little guy. Funny. All right. So it's kind of at 0 right now. We're going to crank that up to 10. include that and see what happens. Will it drop down? I didn't do very good. I thought I could get it to go 0. So this is a compensated. You won't find an uncompensated one in the United States. That's just very rare unless it's in the OR setting. So this is fed through a system, and the hospital here is fed off of a group of large H tanks with a reservoir. It is not a liquid system. So if there was a problem, say something happened in a room on this wing, we would want to go to the shutoff valves out in the hallway and shut off this wing. But that is pretty much maintenance's and security's job in this setting. So you could also have leaks within the system, in which case you would want to have a backup cylinder close by. And I think that's it.